Good afternoon from number 6 Convent Place, and welcome to today's update on the COVID-19 situation. Today I have the pleasure of co-hosting the press conference with my friend and colleague, the Minister for Digital and Financial Services, Albert Isola. I must start by clearly stating that the government notes but does not agree with the guidance note issued by the Data Commissioner today on the question of temperature scanning of clients by private businesses. As a result, and in order to give private businesses legal certainty in this area, government is making the appropriate regulations to put the matter beyond any doubt. This will enable firms to follow the advice and guidelines of public health officials without any fear of breaching any legislation. At this time, it is essential for the benefit of the entire community that technology is used wherever possible in our fight against this virus. This is a particularly difficult time and confusing. So much to take in, so many things that have changed and have to change back or not quite back. The government published the Unlock the Rock document just 48 hours ago. The document takes some reading and understanding, and there will be people who are concerned about knowing what to do or not to do. This is to be expected. Getting back to the new normality will be confusing, difficult even. And what is more confusing still, even for us trying to lead, is that things continue to change. Knowledge continues to develop, and advice has to keep track of that. As the Chief Minister said, much has not been set in stone in the document because it cannot be. The essence of it is that from the second half or so of next week, much of the legal constraint will go. The detail will be published very soon. But I repeat again, the virus is still there, indeed still here, and is still a killer. So the advice must be to stay at home. Home is the safest place to be, and stay away from close contact with anybody not from your household. Yes, it sounds terrible. It's hard even to say it, but it is sound advice. Remember, this is a deadly disease. Tens of thousands who would be alive today, who were alive last Christmas, have died. In the UK alone, yesterday, another 494 people died of COVID-19 related illness. 33,186 have died there in total, and 296,000 worldwide. We in Gibraltar are not immune to this, and the virus is there lurking. It was interesting to hear a question from the media a couple of days ago questioning the Director of Public Health's prediction of a large number of cases and indeed deaths. This was well dealt with by both Dr. Bhatti and the Chief Minister, but I would like to add something here. We first heard about the mystery Wuhan virus at the end of December. Then it was a news story only, and many thought that it would go away without affecting us. But the Director of Public Health discussed the potential problem with me early in January. As Minister for Public Health, I had to take the discussion to the Chief Minister and to Cabinet before it became a civil contingency issue, with the lead then taken, of course, by my colleague Samantha Sacramento, the Minister for Civil Contingencies. It now all seems so long ago. But in those days, remember what this looked like. We had the TV images of Wuhan in lockdown, a city of millions. Never before had this been seen anywhere. People were dying in hospital corridors. New hospitals were being built almost overnight. Indeed, in mid-March, the World Health Organization was predicting 3.4% mortality of infected cases. Seeing what was happening in Wuhan, expecting, say, an 80% infection rate without hand washing, gel, social distancing, and so on, so familiar now, but which were not really even in the vocabulary then, was not unreasonable. But even if we had predicted 40% or lower still, 10% infection rates, the deaths, based on the World Health Organization view at the time, would have been over 100. At the time, and without the benefit of hindsight, it was not an unjustified assumption or prediction. Indeed, Even if only 2.5% were infected, the World Health Organization base prediction was of 60 deaths. Thanks to the measures we brought in based on that advice, we have so far weathered the storm with success. So the advice was well given in the context of what was known. It allowed us to respond, and respond we did. As we know, we won the first round. Keeping the figures down is squarely down to us and how we behave in coming weeks and months. In my last press conference, I gave some information on air quality and how this had improved since lockdown. The latest update, which runs up to yesterday and which I have only just received, shows that pollution levels still remain lower than before the lockdown, despite the partial easing this last week. Last Thursday on Viewpoint, I also gave some information on improved air quality, which some have questioned on social media. They appear to have misunderstood what I said. For Devil's Tower Road, for example, I compared the maximum before and after lockdown. I repeat, maximum, as approximately 160 micrograms per cubic meter before, as opposed to 110 after. The criticism was that these are still high values because the EU standard is 40. This would be correct if I was talking about the mean of the readings, but I was referring to maximum levels at particular times on particular days. The average, which is a significant figure, is below 40. With respect to particles, the so-called PM 2.5, as the first graph, which should be on your screens now, shows, it shows the maximum in December was on one occasion about 40, while in April and even in May it has been as low as 2 and averaging a lot less than before lockdown. These last data are from the new AQ mesh devices that were deployed most recently. The second graph, called a violin graph, shows in a different way how the bulk of readings after lockdown has been lower than before. A full report with all the information will be published by the Department of Environment and Climate Change in due course. I will now turn to some of my other areas of responsibility, culture and heritage. This coming Monday, Monday the 18th, is International Museums Day. Sadly, this year, this very popular event will be held in virtual space with intensified virtual museum activity. Since the virtual museum commenced just 8 weeks ago, on the 17th of March, there have been more than 130,000 visits to its posts on Facebook. Of these, around 83,000 have actually been engagements with the posts. This is a remarkable statistic which reflects the growth of local interest in the museum and in Gibraltar's rich history and natural history during lockdown. Since the start of the virtual museum, the museum's following has also increased dramatically by around 1,250 to a total of 5,155. An estimated 77% of these are from Gibraltar. Again, since the virtual museum started, the museum team has managed to post 162 stories on Facebook and Twitter, with 157 on Instagram. This is a remarkable 3 posts per day, including weekends and public holidays. The virtual museum open day will surpass these figures as the museum's curators and support team plan to make the 18th of May a day of intensified activity that will keep followers entertained throughout the day. Just as in sport, Gibraltar has a huge and highly successful cultural community of people who have kept us entertained during this time and continue to do so. Artists too are painting and sculpting, and we hope to exhibit their lockdown art in the future. In the meantime, a lot is going on in what we call culture in lockdown, with Gibraltar Cultural Services going all out with their work on behalf of the Ministry of Culture. Our online program continues. The next 2 weeks, this will include an array of cultural activities, including material from our cultural archives. We will share with our online viewers the Gibraltar National Dance Championships of 1991, a Gibraltar Youth Centre 1980s documentary, 1992's Rock or What show held at St Michael's Cave, and the 1992 performance of Jesus Christ Superstar, also staged at St Michael's Cave. You may even recognize me somewhere in that one. The virtual tour of the Mario Finlayson Gallery is now online on GCS social media portals. We've launched Arty Tuesdays in conjunction with the Tourist Board and Visit Gibraltar. 48 artists have signed up for the Frontline Workers Project and will be painting portraits for free, culminating in an exhibition to be confirmed after lockdown has been lifted. 26 individuals have expressed an interest in the Lego exhibition, which will culminate in an exhibition on dates also to be confirmed after lockdown. The John Mackintosh Hall Library continues with its initiatives, including storytelling online sessions, book reviews, and the popular lockdown reads. The GCS Art in Gibraltar project is also thriving. Printables and short art clips are being produced by the team at GCS to ensure the community continues to be active at home during lockdown. Culture TV is being updated and finalised, and we aim to release this platform together with GBC in June. 50 artists have submitted a total of 92 digital entries for this year's Spring Art Collection, and we'll be announcing the winners of that very soon. As you can see, we're all gearing up to bringing culture back with a vengeance in a really big way as soon as we possibly can. There will be no better way of celebrating Gibraltar than the Gibraltarians and how we will have pulled through this. In keeping with the Unlock the Rock guidelines, and again, subject to change, the aim is to reopen the National Museum, the John Mackintosh Hall Library, the Garrison Library, and our exhibition galleries after the bank holiday on Tuesday 26th. More details will be confirmed next week, but this will of course be with social distancing and hand sanitizing ensured and by pre-booked appointments only. This last Tuesday, together with my team from Culture, I met with the heads of dance schools, drama groups and academies to discuss how they can unlock. Some, of course, have been continuing their lessons online. We have advised them that we are aiming for them to open in some way at the same time as the schools reopen on the 26th of May. They will need to amend their activities and programs to ensure physical distance, have hand sanitizing available, and ensure regular deep cleaning of premises. We're expecting each school to submit proposals on how they would like to reopen, if indeed they choose to, so that their plans can be scrutinized for public health issues before they do so. The issue of public gatherings and large events is also being considered. These continue to be a serious cause for concern, as they would provide this killer virus the ideal opportunity to spread even if only 1 or 2 infected individuals are present. It is likely that we will follow the precautionary principle as we can take no risks. Theatrical performances, and indeed cinemas, can control this better, provided enough time and space is allowed for queuing and seats are designated with space between them. This can possibly be released a little sooner. The Unlock document sets the main guidelines for this. As from 1st of June, in Unlock Phase 3, performances will be allowed as long as the performers respect distancing and without audience for recording and or streaming. Our present proposals, always subject to change, are that in Unlock Phase 6, from the 3rd of August, our theatres would allow 1/3 of the audience. From the 5th of October, half the audience, and, fingers crossed, a full audience from the 30th of November. The performing arts community has been patiently waiting and is raring to go. Let's hope we can see all of you on stage soon. The question of reopening places of worship is also under consideration in Unlock Phase 3 after 1st of June. This is not easy. Clearly more difficult than opening a theatre or a cinema. There will be many faithful who anxiously await the time that they can return to collective worship, and it will be difficult to control numbers and distancing. I will be meeting religious leaders next week to discuss the way forward. I am grateful to them for having cooperated from the very start, and I look forward to constructive discussions as we look to return to some normality. Yesterday, I accompanied the Chief Minister and other colleagues on a visit to the new public health screening laboratory at the University of Gibraltar. I want to thank the university for making its excellent facilities available at some sacrifice to the PhD students for this most important purpose. I also thank the GHA and its lab for the support in setting this up. And of course, Dr. Nick Cortez, no relation, the GHA's consultant microbiologist, for his invaluable contribution. The new public health lab will be able to process, as we know, 300 tests a day, with the possibility of increasing this further in the future. We have come a long way in just 2 months. This will allow us to test systematically and regularly, starting with frontline workers and those who are otherwise exposed to many people and who so are most likely to be exposed to infection. Followed up with the antibody testing, which we expect to receive next month, as explained by Dr. Rawal yesterday. This will allow us the opportunity to better understand what is happening in the community with respect to the virus, and with aggressive contact tracing, we hope to be able to isolate and obliterate the virus whenever it appears. This means that those testing positive and their household will have to self-isolate for 10 days, as will their contacts. This may appear tough, but it will mean we isolate the virus too, and as the person overcomes it, we kill the virus and so try to make the outbreak die out completely or as much as possible in our community. This aggressive approach to positives means that the rest of us will be more protected and be more unlocked than would otherwise be possible. And now to today's situation report. At Accident and Emergency in St. Bernard's Hospital, in the 24 hours to 8:30 this morning, there were 46 attendances. Of these, only 3 were with COVID symptoms, 2 in the day and 1 overnight. There was only 1 admission to the COVID critical care unit. The patient was swabbed and is negative. So we can once again say, happily, that there are no patients with COVID in any of our hospital facilities. Talking of the GHA facilities, there are currently 410 beds available in all the facilities together, including elderly residential services. And the latest test results are as follows. Total swabs, 4,750. Pending results, 242. Results received, 4,508. Negative, 4,243. Confirmed, still at 147. Active, 3. Recovered, 144. Let me just comment that the figure of 148 a couple of days ago was incorrect and was due to a person already known as positive, testing positive again, one of the 3 active ones. This result was erroneously added to the total when the person was already included in the 147, and of course we apologize for that. But it's still looking reassuring. But let's not forget, we still have work to do in order to beat this bug. As we release the restrictions, we have to be even more aware, even more wary. This virus is deadly and is still at large. The advice is still to stay home if you possibly can, wash hands, keep your distance. And with that, I hand over to another person with very clean, recently washed hands, and at an appropriate distance, my colleague Albert Isola. Albert.
Thank you, John. And just reflecting on those results, ladies and gentlemen, good afternoon. It's heartwarming to see that the good work that we've been doing these past 2 months as a community continues in place, despite the easing of restriction, despite the unlock the rock, as we call it, and the steps that we're taking to try and bring back some semblance of normality. Indeed, for me, personally, it's been an absolute privilege to serve with this team of ministers under Fabian's leadership. I think he's shown an extraordinary ability to pull us all together, to work harder than we ever have done before. Together with you, I think the community spirit that has been invoked since March has been incredible. You will all know it and feel it. The responsibility with which everybody has responded to the advice that we've been issuing in these 55-odd press conferences has been remarkable. Our musicians going to sing to our senior citizens, our volunteers delivering to those in need, our people following the advice and behaving responsibly. It's a wonderful example of what a small community can do together when facing such a difficult challenge as the one that we are currently facing. And as John has said, it's not over by any stretch of the imagination. Are we winning? Yes. Have we won? Absolutely not. As numbers today move closer to 4.5 million people infected around the world, with almost 300,000 people killed by this virus, anybody that suggests that we're through this needs to look at any newspaper or watch any news program to realize that this is still very much alive and unfortunately kicking. In the United States, 36 million jobs have now been lost since the beginning of this pandemic. Those three numbers, those three statistics, give an indication of just what a challenge we have ahead of us. A killer pandemic on the one hand, and a global, what I believe will be a global depression on the other hand. And so how do you look forward when you see that? Well, our model to be able to do that is Unlock the Rock, a document that describes in quite some detail how each and every element of our community is going to ease back into returning to work, whilst at the same time seeking to fight the virus by respecting the rules and respecting the advice that we've received. We have no choice but to continue to fight the virus and to prepare to get our economy moving again if we are going to be able to live up to the challenge that we have. So in education, in business, in sport, in health, in every single measure of our community, Unlock the Rock details how we plan to move forward in the coming weeks and months to be able to deal with that in the best way that is possible. And while so many different component parts of our public sector have been working to fight this killer virus, many others have been working to keep the administration of our community going in difficult circumstances. And not just that, but to prepare us for the future, to prepare to ensure that when we come out of this, we are best placed for the future and that our systems of working are the best they can be as we move forward and we come to what we call the new normal. And of course, that planning for the future has involved every single department working in a slightly different way, under slightly different conditions, in slightly more challenging and difficult surroundings. And so in my own areas of responsibility, I want to thank those in town planning and building control, in gaming and financial services. They quietly got on with their business as usual in the best way possible. In my own department, a member of staff a couple of weeks back tested positive. The offices were disinfected. We followed the protocols that the Chief Secretary had set at the outset of this pandemic, and everybody came back to work normal, no fuss, no noise, just getting back to work to doing what we have to do. And GBC, of course, and other areas of my responsibility. Well, there's an example of somebody standing up to the challenge and surpassing our wildest expectations. So my thanks to each and every one of those teams that I have worked with these past 2 months to carry on doing what we can do to deliver for our community the best choices and the best services that we can deliver to you possible. I also have to thank the areas of the public sector that, of course, are not within my own departments, but who have worked with us extensively, and I'll touch on a few of those as I move forward. And, of course, ITLD and digital services. With them, we have worked together with all the other departments to prepare for the new future. One that looks at e-services as the norm and not the exception. One that, with a few, if any, counters still open as we come out of this pandemic. As you'll know, we've closed our counters. We would like to keep those wherever possible, continuing to be closed and offering you our services in a slightly different way. A system using technology to support the administration to deliver to you a better and more efficient service. And in the time that we've had, these past 2 months, we have already made significant progress. Health card applications are now done online. We've already had 297 applications in the past weeks. The S1 certificates, also online. 384 applications have been processed online. The BEAT applications, the systems to support employees, over 8,000 employee applications have been received, processed and responded to. Over 2,500 emails have been received by the team working on that BEAT measure. It's extraordinary when you think that this didn't exist 2.5 months ago. And in that time, we've developed the programs to enable us to have the application forms online. We've received the application forms online from all the business community. They've been scrutinised and looked through by the Employment Department, the Tax Department, Treasury Department, the Financial Secretary's offices. Legislation has been passed to enable this to happen, and payments have been made at the end of last month, as we said they would be. So my thanks to each and every one of those teams that has helped us to be able to get there in these areas. The online payment gateway is now opening. It's already open. And we're now finalising putting births and deaths through the CSRO online, and ID and civilian card registration forms and processing of renewals also online, and I hope that will be completed shortly. We're also finalising our work with all the forms from the Ministry of Employment, the ETB as it used to be known, with the business community also online. And indeed, everything that the income tax does with you also will shortly be moving online. The Development and Planning Commission, they will have their meetings online. Using technology, we have developed with ITLD a virtual meeting room where the DPC will sit from wherever they are, have virtual meetings. Objectors and applicants can also join what's called a virtual lobby, join the DPC, make their representations, and then leave the meeting for the DPC to continue. That's in phase 1. Phase 2 will enable us to have the entire virtual meeting streamed live and be able to be watched by the public. Parliament, from next week, I expect to be able to have a virtual meeting of Parliament. So members who are unable to attend for whatever reason will be able to sit in Parliament from their offices or wherever they are in their homes. And of course, the famous tracking app, which is so important, a critical part of our easing of our lockdown restrictions. As the Chief Minister has said repeatedly, we've been in discussions with Apple. We've also been in discussions with the Irish government, who are one of the trailblazers of the system that we are seeking to utilise and who have agreed to place their technology as open source. We will have very shortly a tracking app which will be solely and exclusively for the purposes of tracking. So we will not process people's data, we will not require you to give us information, we will not know where you are, but the system will. So by simply downloading the app, we will know once you pump in if you are tested positive with a number. Every single other phone that has the app who's been around you for more than 15 minutes within a certain area over a period of time will get a message saying call 11 and get yourself tested. A critical part of the use of technology to enable us to move forward in a safer and better way. So it's the decentralised system of tracking that we will be adopting. So my thanks to the teams in IT and in digital services for all the work they've done in these and all the other areas that I haven't mentioned that we are currently working on in order to be as e-reliant as we possibly can be as we move forward at the end of this process. And what of the business community? The resilience of the business community has been so welcome and so wonderful to see. We had meetings yesterday, for example, with the Finance Centre Council, a virtual meeting with every single representative body. Nobody complaining, nobody moaning, people looking at what we're facing, how best can we deal with it, what are the opportunities that we see in the future. Their engagement with Task Force Future has been complete and absolute. I couldn't have asked for more. And together we will come out of this in a better position that we came in terms of the opportunities for our community, in terms of the jobs, in terms of the different products that we will be working on with them in the coming weeks and months. So my thanks to the Finance Centre Council for their resilience and their work. Interesting also, last week I told you that the Financial Services Commission had received £1.2 million in fees, even though firms didn't have to pay them until the 1st of July. We deferred the fees until the 1st of July. But firms have said, as we told them, if you can pay, pay. I'm pleased to tell you today that number is no longer 1.2 million, it's now 1.8 million. Another £600,000 has been paid by our financial services firms into the GFSC in the last 7 days. So again, my thanks to all of you. Likewise with our gaming community, as they now begin to prepare for the opening up of sports, albeit behind closed doors, they are preparing and gearing up to sports coming back, to people being able to bet if they want to, either on those or indeed horse racing, which also appears to be ebbing its way back closer to reality. So my thanks to them also for their support and their work. All of these businesses are working closely with us. Even though they're represented in CELAC, we continue to work with them on a one-to-one basis and are grateful for their support and interaction. Task Force Gibraltar, we've received, Task Force Future, we've received all the representations from all the different industries. We are now sifting through those with our respective teams, and I will be sitting next week with Vijay Darinani, Gilbert Ligudi, and beginning to develop our own strategy and challenging our own questions as to how we believe we can be best placed by moving forward together. The Chief Minister has also announced that next week CELAC will be meeting. CELAC has been instrumental in supporting government in all the measures of support that we've implemented, whether they be in terms of the included sector, the excluded sector, all the interactions to ensure that the businesses are protected, the workers are protected through the representations of the union, all sitting around a table together, working together to work what's best for Gibraltar. And so, in concluding, I would just like to say once more, thank you. Thank you to you all at home for complying with the advice. This is a killer pandemic. So we have to stick together, we have to be responsible, and we have to understand what it is that we are seeking to achieve by following the advice that the Public Health Department is giving us. I would also like to thank our business community for their resilience, their forward thinking, and their support. Thank you very much. We're now very happy to take questions.
Thank you. Minister Cortés, you said in your opening statement regarding the guidance notes from the GRA that you disagreed with it, but that you've actually gone back to the legislation and changed it. Now, if there was nothing wrong with the legislation, you wouldn't have to have had to change it. Is that correct? And if so, what is it specifically about the GRA's line that you disagree with? Either it's correct or it isn't.
This is within Albert's area, so...
Yep, I'm very happy to take that question. Look, the GRA is an independent body. They are not reliant or dependent on government or whether government likes their views or not. It's their job to do what they've done. And so I entirely respect both their view and their ability to come to that view. That's the first thing to say. The second thing is that we don't agree. They're an independent body. We're perfectly entitled not to agree. As far as we are concerned, if the choice is, at worst, and it isn't there, but I'll take it to give you the example, to put people's lives at risk or comply with a piece of legislation which we don't agree with, then the choice is obvious. Our position will always be, every day of the week, to protect the lives of our people. But it's not even that, because in our view, the Data Protection Act provides for a legitimate interest. And I actually believe that the legislation already provides the ability of firms relying on the public health advice that's been issued. They have a legitimate interest in following that advice. They have an obligation indeed to do so. And therefore, for them to put these thermal imaging cameras at their stores, they have to protect their own employees. They have to protect their own businesses. So that's the legitimate interest that they have in following the advice of the public health authorities. So, notwithstanding all of that, if the GRA comes out with a statement that says businesses could be breaking the law, I believe we have an obligation to step in and make it clear beyond any doubt and peradventure that as far as we're concerned, it's not. And that's why we've taken the steps that we have.
From the Chronicle, in respect to the new traffic restrictions and the inevitable knock-on effect this will have in terms of increased traffic along Queensway, how does that marry with the GSLP Liberal manifesto pledge to turn Queensway into a green lung?
Okay, absolutely. There's a couple of things here. Remember that people are assuming that all the traffic will pile up in Queensway. And there are several aspects of this because you are moving traffic away and some of it will go to other areas, but as we've said very clearly, the intention is that it will be dissuading people and that people will opt to use other methods like walking, cycling, because Langwell Road will be so much more welcoming to walkers and to cyclists. The question of Queensway's green lung is still there. The intention is still to create these parks along the way which have a great effect in absorbing pollution, and the plants and trees are known to absorb pollution. So having the traffic there where the green areas are will actually be, I wouldn't say positive, but in a way it will be mitigated. But remember that this is just one of a series of strategies which are aimed at reducing traffic overall. And we are confident that the steps that we are going to be introducing will reduce traffic overall, and that will not be the problem that some people think it's going to be.
And can I also add that we've said this is a pilot scheme, and there actually is a consultation paper out at the moment and seeking feedback. So I think there's a lot still to be done before we begin to conclude how things will end up finally after the pilot programme is over.
A question from YGTV for Minister Isola. Many government services, interactions and payments quickly moved online when the pandemic started. Will these services remain in their current format, or is the plan to integrate them in one platform or develop a user-friendly app?
Well, I think I've explained during my presentation the work that we're doing and have done and will be doing to bring as much of the government service as we can online as quickly as possible. Gov.gi is the place where it will all be happening, and it already is happening, and we will continue to develop. I think, if I can call it, the first phase will be rather cruder than we would like, and then it'll be improved as it goes along. But it's important, if we seek to reopen as few counters as is absolutely possible, we need to be able to provide those services. And so, yes, the work I've described already will continue at a furious pace to be able to provide the people of Gibraltar with the services online as quickly as we possibly can.
Next question is from the Panorama on behalf of one of their readers. In the last briefing, the panel doctor stated that the government of Gibraltar was purchasing tests from Abbott Laboratories in UK. Has the Abbott antibody test been approved by the researchers at Public Health England for its 100% effectiveness? If not, why not order the test from Roche Pharmaceutical Company, which has been proven to be an effective test?
Okay, we must remember, as I keep on saying, we all keep on saying, things are changing all the time, and I believe Roche has recently had a certain level of approval, but that is very recent. This wasn't known at the time when the tests were ordered. I am told, and the information comes from the GHA, and I'm sure the next time that either Paul or Krish are here, you can ask them directly, or you can send in a question, of course, that there have been antibody tests ordered from 3 different suppliers. I believe Abbott, Diacerin and Beckman are 3. I'm not sure about Roche. We would have to confirm that. But the orders were made to more than 1, at least 3, because at the time the test was still being developed. We didn't know which would be approved first, so we didn't put all our eggs in one basket. So I am pretty sure that we will get tests which are going to be working and acceptable.
The next question is from the Olive Press for Minister Cortés. Considering second waves in a number of places around the world and the warnings from the WHO that COVID-19 could be endemic, to what extent would you say that the lowering of lockdown restrictions is as much a push for herd immunity over time as it is a seek and destroy strategy?
Okay, I think that everything we're doing and everything we're saying, and the reason why we're being very cautious and we're saying things are subject to change, is in order to prevent a second wave coming. If indeed we had a first wave and not a first ripple. But everything we're doing is in order to stop a second wave coming. If we were looking for herd immunity, or as I prefer to call it, community immunity, then we wouldn't have that strategy. We would say, we probably wouldn't have done what we've done. We would have said, okay, out you go, everybody catch it. Now, at one stage it was thought that immunity would develop. Now we are not so sure. We are hoping that with the antibody tests we will be able to determine what kind of immunity we have in the community. But look, people need to get their lives back. People are really very patiently, and I mean, I add my thanks and the thanks of all the government to Albert's thanks to the people for being so considerate and doing everything we're asking them for to do. But they need their lives back. We need to get the economy back on track. This is critically important, but never at the risk of a single Gibraltarian life. So we are not going to take steps in which we encourage people to catch it anymore. We're not in that game. We've been looking at, or in fact, we've been successfully working at suppression. Now we're looking at containment. So no, we're not looking for herd immunity, community immunity. We're trying to control and get rid of this virus as much as we can.
Minister Isola, when you were talking about the tracking app, you described it as decentralized technology. Does this mean that neither the GHA nor the government holds information about who's been in the presence of whom, and that data is held somewhere else separately, decentralized technology, and that the only information that the GHA has is who needs to be swabbed? Am I correct in that?
That's exactly right. There are the different apps that are out there tracking manage data in a different way. So, for example, the UK, which we'll see if they persist because I think they're going to change, they actually held people's data. And so Apple and Google will say, we're not going that way, we're going a different route. So these guys went and did their own. The European model, and the model that we are working with Ireland on, is that the person who has the phone, the data is his and no one else's. But we've taken it a step further, because what we've done, and I think we're the only people that are doing this, is when you download the app, you will not even require to register your name. We are keeping no information on anybody. Why? Simply because if this is going to work effectively, we need more than 60% of the people to download this app. And if people are worried about data, worried about their privacy, worried that government's going to know where they are or where they're not, then that's going to lead people not to register. So we want everyone to register. So the absolute minimum that they're going to do when they come to this app is click on. And when they download and click on, if they then have been tested and it's positive, they will simply put their code number into their app, they will press send, and the app itself will send to all the people they've been close to a message saying, somebody that you've been in contact with, we won't tell them who or what the number is, has tested positive, call 111 now and book an appointment to be tested. So what we've tried to do is to get the cleanest, simplest version of this app just to do the job that we want to do. There will then be a second app which will have a lot more information. And of course, the more information that people unload into those apps, and self-assessment tests and all these sorts of things, which will be very valuable to us in terms of data. If we don't get 60%, it's supporting the work we're doing, but it won't withhold people downloading the critical tracking app, which is what we want them to do. So, in effect, yes, nobody will know, neither the GHA nor government. It's simply the person with the phone, and the phone will itself send the message once you put in that you've been tested positive.
From the Chronicle. We've been contacted by a number of businesses who have questions about their BEAT applications, and they're frustrated that the only point of contact seems to be an email address. Is the government satisfied that its process for addressing queries on BEAT applications and providing additional information to businesses is sufficiently clear and effective?
Absolutely, yes. And I'll explain why I am so confident in that response. The people that have been managing these 8,000 individual employee applications and these 2,500 emails have gone way beyond the call of duty in dealing with some of the ineffective and clumsy way in which these applications are handled. The law is really clear on what you can and can't do. The application form is really clear on what you can and can't do. And yet some firms are making 2, 3, 4, 5, 6 applications for the same month. Some firms are filling in an application form, forgetting to press the button which says submit, and then emailing us to complain that they haven't had a response. Look, there's a limit to what people can expect government to do. And I want to thank each and every person that's been involved in this process, dealing with, quite frankly, ridiculous questions from some individuals in the business community who have made the most stupid questions and stupid processes in managing what I think is a relatively simple application. So what I would beg our firms and our people to do is to just read the applications carefully, do it once, do it properly, and it saves a lot of work for them and an awful lot of work for us. So would it have been possible for us to do 8,000 employee applications, design, build, scrutinise, tax, employment, treasury, financial secretary's office, check within the time we have. Any other way, by having a telephone hotline with 8,000 people ring it? I don't think so. I think we've done it the best way in the circumstances that we could have done. We've paid out over £6 million in 1 month, and I just congratulate the people that have been involved in putting that, and I ask the employers and the self-employed to take a little more time, a little more trouble, and help us by making our lives easier, by going into the detail of what they're meant to be doing and doing it properly.
From the Panorama, when is the government going to consider putting a stop to the security control and manning the entrance to the elderly residential homes? In view that the elderly in these blocks are going out now, it really does not make a lot of sense to continue.
Okay, this is currently under discussion. There was a meeting of the COVID core group this morning in which the Minister for Housing was present, and this is currently under discussion. We have to be careful that we don't release the stops. Remember, the elderly are the ones who are most vulnerable, together with some medical conditions. We have successfully protected them. Once again, remember the horrendous figures for the UK of deaths in care homes. We have, sadly, and thanks again to the elderly for cooperating, we've locked them away, and we have to ensure that as we unlock, we keep protecting them. But clearly, we are at a stage, as we've said before, where the incidence of the virus is very low, fortunately, in our community. We are slowly releasing, and this is currently under discussion, and we hope to have a clear way forward very, very soon.
A question from YGTV for Minister Isola. You have said that you seek to reopen as few public counters as possible. Would this be on public health grounds, or is this the new and permanent way the civil service will operate?
Well, I think that we've made it clear for quite some time. We've made a number of announcements in the work that we're doing with employment and tax in the first phase, and our desire to move all of those services online so that people don't have to go. So the impact of that is less public counters. With the advent of COVID-19 and the pandemic, obviously we immediately shut the counters on public health grounds. And obviously this is not going to be over on the 15th of June when people go back to beaches. Social distancing is still going to be an issue for quite some time yet. So they are both very sensible and logical reasons as to why we should seek to have as few public counters open as is possible. From my own perspective, I've been working to have fewer counters open and only when absolutely necessary, even before we came to the pandemic. But now with the pandemic, I think even more so do we have to work harder to make sure that we can achieve that.
The final question is from the Olive Press for Minister Cortés. Do you agree with the research conducted by environmental research company Q Wisely, which suggests that static traffic jams cause the most pollution? These have been prevalent at peak times around the area of Ragged Staff Roundabout. With the closing of the traffic along Linewall Road on June the 1st, are you considering, for example, a traffic light system to ease vehicle flow in this area and therefore stop the release of pollutants, which is the original reason for the new measure?
The Minister responsible for Transport, Vijay Daryanani, as you may know, has been holding meetings this week and is consulting widely. Obviously, my own Department of the Environment is working closely with Vijay and his team, and we are considering what measures we will take in order to deal with that issue, the issue that the Chronicle asked earlier, to ensure that pollution levels are kept to an absolute minimum. We will be able to monitor, and as Albert said, we will monitor and see how this develops, but we will have a plan together which obviously will be shared before the effective date.
Ladies and gentlemen, as the Chief Minister has already mentioned, this will be the last week of these press conferences, and so it will be my last and probably my friend John's last press conference with you. So you'll be delighted to hear that we won't be coming into your sitting rooms in the coming weeks, which will be a great relief to you all. But as we try and ease our way forward during this easing off of the lockdown restrictions, I would just beg you to remember that because we're easing restrictions doesn't mean we've won the war. There is still some way to go. The killer pandemic is still going to be there, unfortunately, for quite some time. And I would ask you to please follow the advice that we continuously give. Stay home, stay safe, look after yourselves, and thank you for listening. Good afternoon.
Good afternoon.